Good morning, Mr. Fowler. How are you?
Norman Fowler served as Health Secretary from 1981 to 1987.
There is now a danger that has become a threat to us all. It is a deadly disease and there is no known cure.
He was the architect of one of the UK's most high-profile health campaigns. AIDS was emerging as a deadly global threat. The idea was to shock the public into taking preventative action.
If you ignore AIDS, it could be the death of you.
I think it was probably one of the most successful public education campaigns since the war.
Lord Fowler was giving evidence to the infected blood inquiry. He was challenged on the messaging of the campaign and the effect it would have had on those infected with HIV through the use of contaminated blood products.
Was any consideration, conscious consideration at least, given on what the impact might be on them, this already vilified cohort?
You have to make some choices. And the choice was, first and foremost, to actually prevent this epidemic going even further and further.
Jason Evans lost his dad in 1993 after Jonathan became infected with HIV and hepatitis C through contaminated blood products. He was one of thousands of haemophiliacs and bleeding disorder patients infected in the 70s and 80s in the NHS scandal. What sort of impact would an advertising campaign like that one have had on your father and your family?
My mum's told me stories of him being at the funerals of his friends and him saying, I'm going to be next, I know it. And eventually he was next, but that fear of knowing it, compounded by the government saying you're going to die, you were ignorant, the falling tombstones, the lilies. It was just, I think insult to injury is putting it really lightly.
The inquiry will continue to hear evidence into next year, but after waiting decades for justice, the infected and the affected might feel their search for answers is getting closer. Ashish Joshi, Sky News.